Hello, and welcome to the Lake Health Diabetes Education Program. My name is Marjorie Lang, and I'm the Diabetes Education Manager of the Diabetes Education Services Program here at Lake Health. The program focuses on diabetes management for those with the condition of prediabetes, type 1, type 2, as well as gestational diabetes. Today we present to you this video which discusses some of the important topics in diabetes self-management. Our team of talented diabetes educators and certified health coaches are comprised of registered nurses and registered dietitians who can help you with lifestyle change to improve outcomes related to your condition of diabetes. Contact our department today to schedule a diabetes class or an individual assessment. We look forward to working with you during this time, and if you have any additional questions or concerns related to your diabetes diagnosis, please feel free to give us a call. Thank you.
Hi, we're going to talk about how to inject using a vial and syringe. First, I just want to let you know any unopened vials need to be refrigerated, and then any opened vials can be left at room temperature. So this one just came out of the refrigerator, so it's got the cap on it. So before we start, the first thing we're going to do is wash our hands with soap and water or use hand sanitizer. We want to rub your hands together until they dry. So today I'm going to be using NPH insulin, and I want you to notice that it's a cloudy insulin. Regular insulin, and there's some other insulins that are clear, but when it's cloudy, this is very normal. So when you're using cloudy insulin, you want to make sure you roll it in your hands to mix. We always want to make sure we get an accurate mixture. So each time, roll it in your hands like for 6 seconds so that you know it mixes completely. The benefit of NPH is that it's 70% longer acting insulin. It works in the background to try to keep those numbers in control between meals and usually for breakfast and dinner. And it's 30% regular insulin, and that covers your meals, breakfast and dinner. But just because it only covers breakfast and dinner, it's important that you know that you need to eat lunch. So we want to make sure you're eating 3 meals a day, especially with NPH insulin, because you run a risk of having a low or hypoglycemia. So it's important that you do eat lunch. It's only 2 injections a day, and there's a great cost savings for it. You do not need a prescription. You can get it at Walmart. It's usually about maybe $20 to $25 a vial. So that's one reason that we really like using the NPH insulin. So the first thing you want to do is pop the cap off, because this is a brand new vial. It'll have the cap on it, so we're going to just pop it off. Then we're going to take our alcohol wipe, and we're going to mix or wipe the top of the rubber membrane, and then we're all set to use it. Now we're going to pick up our syringe. Our syringe has 2 caps on it. The bottom one just pulls off, and that's the plunger, and we can dispose of that. And then the top needle. So we're going to pull that cap off. It's kind of tight. There we go. It's really important to take a look at your syringe. We want to make sure when you're giving insulin, it's in units. So we want to make sure it actually says the words units on the syringe. And then we want to look at the numbers on the side of the syringe. So if we look at this syringe, we see these numbers are 5, 10, 15, 20, 25. So we know that this is in 5 number increments. There's some syringes that go by 10 units. So you want to make sure you're using the correct syringe. Okay, so the first thing we want to do is notice in between the numbers. So between 5 and 10, there's 5 little numbers, and those each stand for 1 unit in between. So if you were going to give yourself 7 units, you would just go 2 down from the 5, and that would be 7 units. When you're using a syringe that goes by 10 units, there's still 5 lines, but they're 2 units each. So you want to make sure you're aware of that. So if you go 2 lines down from 10, that would be 12. So it's really important to make sure you're using the right syringe. So first thing we're going to do is your prescribed dose. You want to make sure you pull air into the syringe. So if I'm getting a 10 unit dose, I pull it down to 10 units of air. And notice on the syringe, you want to use the top line, not the bottom. So it's the very top line is right on the 10. It's filled with air. We're going to just put it straight into a clean vial and push the plunger in. Then we're going to turn the vial, flip it over. And sometimes this can be awkward, but the more you do it, the easier it gets. We're going to slowly, like if you just let go of it, it'll stay in there. Very slowly pull down to 10 units because that's our dose. So you may want to pull just a little past the 10. So right there's one line past the 10. And I just want to check to make sure there's no air bubbles. Now the air bubbles won't hurt you, but you won't get an accurate dose. And that's the most important thing, is we want to make sure we get an accurate dose. So I'm just going to push a little air back in, or a little insulin back into the 10 line, so that I know we have exactly 10 units in here. Take the bottle off. Look at it, make sure there's no air, and now we're ready for our injection. So their abdomen is the best place to inject insulin. So you want to find your belly button, put 2 fingers all the way around your belly button to make sure you stay on the outside of that. It's safe to use your entire belly from under the rib cage to your hip and as far lateral as you can reach. We want to make sure we're rotating our sites, which means every time you give yourself an injection, you want to switch spots because you could build up scar tissue if you're continuously injecting the same area. So I'm going to pretend this is my abdomen. We're going to hold it like a dart or like a writing pen. And you're going to go straight in at a 90-degree angle, straight in. Once you get it in, you're going to push the plunger all the way in. And then you're going to count slowly to 6 to make sure you don't remove it too quick. 1, 2, 3, 4, 5, 6. We're going to take it out. And that's it. We've injected ourselves using a vial and syringe. And then we want to make sure we dispose of this in a puncture-proof container. If you don't have a Sharps container, you can use an empty laundry detergent bottle or a coffee can or an empty prescription bottle. Just make sure it has a cap so nobody gets injured. Thank you for watching our videos, and please, if you have any questions or concerns, leave us a note in our comment section and we will get back to you. Thank you very much for watching.